So this week's responding to your comments is all about erectile dysfunction. We've got a comment from user 399 who commented, please make a video on how to improve erectile dysfunction and treatment options. Well, what we're waiting for, hit that like button if you're fired up for this, and let's go. So let's dive straight into tip number 1, because in this video we're going to start with what you can do at home that actually helps, and then we're going to move on to treatment options for erectile dysfunction. So let's kickstart our journey with exercise, because there are so many studies supporting exercise for erectile dysfunction. Just by doing 30 to 60 minutes of aerobic exercise, so for example walking, jogging, cycling, 3 to 5 times a week can help boost erectile function, which is amazing. Okay, so it's now time for a bit of science about exercise. Exercise promotes our cardiovascular health. This means better blood flow to our penis, which means a stronger erection. Also, it aids weight loss. It also regulates blood pressure, and it boosts the production of nitric oxide. Nitric oxide, imagine it as the ignition that we need for an erection. It also helps boost testosterone production. So overall, exercise is the #1 thing you need to be doing if you're struggling with erectile dysfunction. I can't recommend it enough. Moving on to tip number 2. Certain medications such as thiazide diuretics, such as beta blockers, such as serotonin reuptake inhibitors can all contribute to erectile dysfunction. So switching your hypertension medication or your antidepressants can help with erectile dysfunction. The best thing to do is speak to your healthcare professional about this and see what they recommend. Do not stop your medication without letting them know. And diving straight into tip number 3, erectile dysfunction medication, the most popular being phosphodiesterase type 5 inhibitors such as sildenafil and tadalafil are extremely popular. But here's the thing, many patients are missing a few really important things for maximum benefit, which I'm going to teach you now. So 1, take them 30 to 60 minutes before action. 2, take them on an empty stomach for better absorption. 3, avoid alcohol when you're taking them. Alcohol is a natural depressant of your central nervous system, which means it's going to be much less effective when you take the medication. So avoid alcohol. Now, if you're in the UK and you want more information or treatment options for a particular health condition, then let me tell you about our sponsor, Dr. Fox. Dr. Fox is an online doctor and pharmacy ready to help with over 30 different medical conditions, and I'd highly recommend visiting their website to learn more about their services. I will leave a link to them in the description below. And moving on to tip number 4, please stay away from supplements and herbal medication for erectile dysfunction. Reason being that I don't like them is they are unregulated, so you never actually know what they claim is in the bottle, so there could be potential side effects from that. And secondly, they make bogus health claims. They aren't following any regulation, so they can make bogus health claims, which then influences your decision, and then it has a placebo effect as well, which makes people think they're effective when they really aren't. Placebo effects, believe me, can be extremely effective. So my word of advice, I'm going to make it nice and short, stay away from them, avoid them. And diving straight into tip number 5, lifestyle changes. So first of all, studies have shown the best diet to follow for erectile dysfunction is the Mediterranean diet, the heart-healthy Mediterranean diet. So you need to avoid processed foods, avoid saturated fat, and instead go for whole foods, fresh foods. Also, you need to reduce or eliminate alcohol entirely. Reason being is that alcohol depresses your central nervous system. This means that the message from your brain to your penis slows down, and that is going to contribute to erectile dysfunction. Also, if you do smoke, quit smoking. And moving on to tip number 6, vascular issues, high blood pressure, high cholesterol, smoking, lack of exercise are all primary culprits of erectile dysfunction. Also, diabetes, over half of the men will suffer with erectile dysfunction. So the reason I'm telling you this is, it is super important to speak to your healthcare professional if you have erectile dysfunction first, just so they can check and find out if there's anything else causing it. This is one of the most important things you need to do. I really hope my tips help in this week's video. As always, sending awesome vibes.